Since we're still going through the pandemic, is your workforce still remote or are they on site now?
I was hoping you would ask about this. There's two aspects of this that I would love to talk about if you don't mind. I mean, first is the the whole looking beyond the pandemic and what does the new workforce look like. So our staff during the pandemic, from an IT and analytics perspective, have almost all been remote during this time. Like so many articles we've all read, they have been extremely productive. They have not missed a beat. They have done amazing work. I worry about burnout. I really do, with the pandemic and all of the pent up demands before the pandemic that are now beginning to kind of be brought back to the front burner. I worry about the state of where they are. We've recently done an engagement survey to try to understand where folks may be struggling or having some issues. And we're looking forward to seeing those results and trying to see if there are interventions and changes we can make to try to help improve that. But for the most part, we've fully embraced the remote work like everyone else for them across the country. I think we're at a place right now where we're doing a lot of planning. We're going to offer to our team members the ability to continue working remote for those that don't have to physically be in the office to touch things or work directly at the elbow with our care teams. We're going to offer, obviously, the opportunity for folks to come back on site full time, but we are going to offer a hybrid model to our workforce. And I suspect, Bill, that's what most of our team will fall, the bulk of our team will fall into that hybrid model where, a couple of days a week at home, a couple of days a week in the office, and hopefully try to do that in a flexible way, but in a way that also allows some team cohesion, where we can have scheduled face-to-face team meetings or gatherings on a quarterly, monthly, whatever basis. I think that would be important. I do worry about the social aspect of what this has done to folks. And I do think that as we're thinking about and planning for this, we've really got to figure out how we are keeping a pulse on potential burnout and some of those sort of psychosocial issues that come with maybe not being in the office every day with your coworkers and having those hallway conversations at the coffee pot or water fountain.
Yeah. And how much of that is done as a system when you're sitting with HR and everybody and having the conversation? And how much of that is done with you and the CIO and the IT leadership making decisions based on your specific work requirements or needs?
We're absolutely doing this in a strong partnership between IT and HR and facilities. And so we're meeting weekly right now as leadership teams across those areas to try to think through this. And one of the key guiding principles that we have is we're a relatively large health system now. We've got about 40,000 total employees and providers, and we've got 5,000 plus what we back office workers. And that's a pretty substantial, number of folks to try to coordinate and think through. And we want to be consistent. We don't want to have individual departments creating new and unique and different ways that could create some internal grass is greener type of thinking in terms of, oh, well, look what that group is doing and why don't we have that, opportunity capability. We'd like to be consistent. So we're working very closely together to try to drive this as a system.